The BC Medical Services Commission has given final approval to a new standard outpatient laboratory requisition developed by a joint committee of the BCMA, MSB, after a multi-year process involving numerous committees and stakeholders. Please note that laboratories submitting claims to MSP for laboratory services are obligated to use this new SOPLR, and this is the only requisition acceptable to MSB MSC for outpatient laboratory testing. When you receive the new requisitions, please begin using them immediately and discard all old requisitions. If you use an electronic medical record generated requisition, it must conform exactly to the SOPLR, including the privacy and quality assurance statements at the bottom of the requisition. Requisitions not complying with the SOPLR cannot be accepted. BC Biomedical Laboratories has been in contact with many of the EMR vendors to ensure that they are aware of this requirement. The requisition has had an overall redesign to incorporate additional tests. It provides more tick boxes, which we hope will reduce missing or wrong tests due to order entry errors because of illegible writing, use of non-standard abbreviations, etc. Here are the top 10 changes to the standard outpatient laboratory requisition that you should be aware of. New tick box for penicillin allergy. This alerts the laboratory to provide appropriate susceptibilities for penicillin allergic patients. Separate tick boxes for N-gonorrhea by nucleic acid technology or by culture. This allows physicians to order a culture rather than testing by NAT when appropriate. A new tick box for C. difficile testing on stool samples. Expanded hepatitis serology tick boxes. Listing of tests conducted for acute and chronic viral hepatitis serology of undefined etiology. Listing of tests conducted for investigation of hepatitis immune status. New tick box for HBsAg. Using these tick boxes should avoid having the laboratory placing telephone calls to your office for clarification of orders. Change to the protocol for the gestational diabetes glucose tolerance test. Compliance with recommendation from the International Association of Diabetes and Pregnancy Study Groups. New tick boxes for hemoglobin A1C and urine albumin creatinine ratio. Frequently ordered tests for diabetes management. ACR is also frequently used for monitoring hypertension. More streamlined investigations for dyslipidemias and provision of a new tick box for apolipoprotein B, in keeping with recently revised guidelines. Thyroid testing protocol. Clarification of the follow-up investigations, free T3 or free T4, which may be conducted depending on results of the initial TSH for suspected hypothyroidism or hyperthyroidism. New tick box for TSH only for monitoring thyroid replacement therapy. New tick boxes for chemistry tests. These are among the most commonly ordered chemistry tests, and all are on the discount list of the laboratory medicine fee schedule. New tick boxes for ECG and fecal occult blood, which are commonly ordered tests.